31,000 years ago. A cave on the island of Borneo. A child lies still, their lower left leg gone. Not torn off by an accident, not bitten off by a predator. Cleanly removed, by someone who understood exactly where to cut, exactly which veins to avoid, exactly how to stop the bleeding. That child didn't die that day. They lived, for years afterward, which means somewhere, in a cave, tens of thousands of years before hospitals existed, someone performed a successful surgery. Welcome to the story of the first doctor. Before you say, "That's impossible without modern medicine," let me stop you. For decades, historians believed complex surgery was a byproduct of civilization, something that only appeared after humans built cities, developed writing, and organized medical knowledge. This discovery, published in the journal Nature, destroyed that theory completely. It predates the previous oldest known amputation by 24,000 years. So the real question isn't, could ancient humans perform surgery? We know they could. The real question is, how did a hunter-gatherer with no metal tools, no antibiotics, and no written knowledge keep a child alive through an operation that still carries risk today? Let's understand exactly what happened here. In 2020, archaeologists excavating Liang Thibaut Cave in Borneo uncovered a complete human burial. The skeleton belonged to a young hunter-gatherer. Multiple dating techniques confirmed the remains were 31,000 years old, making it the oldest known grave in Southeast Asia. But it was the legs that stunned researchers. The lower left leg was missing, not from decay, not from an animal attack. The remaining bone showed a clean, deliberate cut, and the bone had healed. Researchers found 6 to 9 years of bone remodeling around the amputation site. That means this individual didn't just survive the operation, they lived for years afterward, well into adulthood. To put that in perspective, researchers point out something remarkable. Even today, preventing infection after an amputation is notoriously difficult. Someone, 31,000 years ago, successfully navigated veins, arteries, nerves, and tissue, then kept the wound clean enough to heal with none of the tools modern surgeons rely on. No metal scalpel, no anesthesia, no antibiotics. So how does someone perform an operation like this, without any of the tools we consider essential to surgery? The answer says something remarkable about how much ancient humans actually understood about their own bodies. Think through what this operation actually demanded. Whoever performed this surgery needed to know precisely where to cut, avoiding the femoral artery, which could cause the patient to bleed out in minutes. They needed to understand which nerves controlled sensation and movement. They needed a way to control bleeding during the procedure itself, and afterward, they needed knowledge of wound care. Researchers believe the survival of the wound almost certainly required the use of medicinal plants or natural antiseptics to prevent infection. This wasn't guesswork. This was applied anatomical knowledge, passed down and practiced with enough precision to save a child's life. But surgical skill alone doesn't explain everything, because a successful operation was only step one. What came after mattered just as much. A child with one leg in a hunter-gatherer society in dense tropical rainforest couldn't hunt, couldn't easily forage, couldn't keep pace with a nomadic group. By every survival logic of the time, this child should not have lived long. And yet, the evidence says they did, for years. This is where the story becomes about more than medicine. A researcher involved in the discovery put it simply: caring for an individual after a procedure like this would have required real support from the entire community. Someone had to carry this child during travel. Someone had to help them navigate rough, mountainous rainforest terrain on one leg. Someone had to protect them, feed them, care for them for years in a society where mobility often meant survival. This wasn't a burden the community chose to abandon. Researchers describe this as clear evidence of compassion and cooperation, often underestimated in early human societies. We tend to imagine hunter-gatherer life as brutally practical, survival of the fittest, with no room for anyone who couldn't contribute physically. Borneo proves that assumption wrong. This community didn't just have the medical skill to save a life, they had the social structure and the will to sustain it. And this wasn't an isolated case. Once researchers knew what to look for, Evidence of ancient medical skill started appearing all over the world. Borneo isn't alone. Skulls from a Ukrainian cemetery show trepanation, the deliberate drilling of holes into the human skull, practiced more than 9,000 years ago. The same practice appears across the world, from ancient Greece to the Incan Empire. By 5,300 years ago, humans in northern Spain were performing ear surgery, cutting into a patient's skull to relieve pain. Some Egyptian mummies show evidence of amputation, including one fitted with a 3,000-year-old prosthetic toe. For decades, scientists assumed complex medicine began with the Neolithic Revolution, when humans settled into farming societies roughly 10,000 years ago. The Borneo discovery pushes real surgical skill back 21,000 years earlier than that assumption, long before agriculture, long before permanent settlements, long before written language. Someone was already a doctor.
Here's what I want you to take from this.
We like to imagine our ancestors as purely survival-driven, focused only on hunting, eating, and staying alive one day at a time. But somewhere, in a cave in Borneo, 31,000 years ago, someone chose a different path. They looked at a child who, by every practical measure, should have been left behind, and instead, they picked up a blade. They studied a body they didn't fully understand, and they saved a life. Not because they had to, because they could, and because they cared enough to try. The first doctor didn't have a diploma, a hospital, or a single modern tool. They had knowledge, courage, and a community willing to carry someone else's survival on their shoulders. Subscribe to Human Roots. Comment below, what do you think ancient humans used to prevent infection thousands of years before antibiotics existed? See you next time.